Hi, I'm Todd Pendergraft with Broken Arrow Family Drug, and as my patients know, we have a program at our pharmacy where we will take back unused medications for destruction. And yesterday I had a gentleman come in who is not a patient of ours asking if we were able to destroy some unused medications and diabetes testing supplies for his now deceased relative. And I told him that we did, and he brought the products in, and I thought that it would be a good idea for me to use these products to give you a visual of how much medication and how many diabetes testing supplies are being wasted by the use of the mail order pharmacy system. Now, unfortunately though, I was not able to fit the products that the gentleman returned on my table here in my office. So we're going to have to go out onto my sales floor so that you can see exactly how much product was returned and wasted for this gentleman. Come with me. This patient was a patient who was eligible for benefits through the Veterans Administration, through the VA, and also through Medicare Part B. As you can see, they were shipped far more product than they could ever use. The Veterans Administration products are from here over, and we have strips, we have lancets, we have insulin syringes, we have insulin, and we have all kinds of prescription medications as well. There are at least a couple of years worth of oversupply of strips and lancets here. We have 28 bottles of insulin here. We have 800 insulin syringes. We have several prescription medications that there are well over a year's worth of oversupply that the patient had. And then over on this side of the table, this patient had got signed up on a Medicare Part B mail order pharmacy in order to receive diabetes testing supplies from them as well. And so we have roughly 5 years worth of diabetes testing strips here and lancets, and we also have a number of meters that were billed to Medicare Part B over the years. There are 11 meters here. There are about 15 or 16 lancing devices here. So you wonder, how does this type of thing happen? Well, there are 3 primary reasons how this happens in this particular case. Number one, you have 2 different government agencies who are supplying diabetes testing supplies to this patient, but neither of them were communicating with one another, letting the other know that they were managing it. The second reason that this happens is because the patient was set up to automatically autofill his strips and his medications. There was no communication between the supplier and the patient asking if they needed the medication sent ahead of time. It was simply sent on a particular day of the month to the patient, whether he needed it or not. The third reason that this type of thing happens is because the patient uses a mail order pharmacy instead of using a local pharmacy. There is not a relationship there between the patient and a pharmacist. There is, in this circumstance with a mail order pharmacy, you have a relationship between a patient and the mailman. And it's not that I have any problems with mailmen, it's that it is not a patient-provider, medical provider relationship where these types of things would get caught. If the patient were to use a local pharmacy as opposed to a mail order pharmacy, the local pharmacist would understand that the patient is not on some of these medications anymore. They would understand that the patient is not using 2 or 3 or 4 different meters. They're only using 1. And the pharmacist would understand that the patient has an overabundance of strips and isn't in need of a refill at that time. Let's go back to my office. If you think this only happens with government programs, you would be incorrect. This happens with private insurers as well. I just had a patient return to me a medication that is used for rheumatoid arthritis. In my hands I'm holding about $3,000 worth of medications that is going to be wasted that they were required to get through their specialty mail order program. Understand that employers and employees are paying for this waste. If you're a self-insured employer, you are paying the entire bill for this wasted product and the oversupply of medications that happens out there in the marketplace. If you are a fully insured employer, you and your employees pay for this through higher premiums every year. So medications like this end up going in the trash and costing you money. Prescription benefit managers such as Express Scripts and Medco and Caremark like to argue that they save the employer and the employee money, but what they will never show you is the amount of waste that is inherent in this system over the course of a year. Every year, hundreds of thousands, millions of dollars worth of medications are destroyed at a local level and sometimes literally flushed down the toilet by patients who are using mail order programs. The mail order pharmacies and the prescription benefit managers that own them have a benefit in getting people signed up through their mail order so that they can autofill the prescriptions, fill them, bill them, regardless of whether the patient is even taking them anymore. It doesn't matter to them whether the prescriptions are destroyed after the fact. They've got their money. The solution to all this is to stop pretending that mail order pharmacy saves the system money. Pharmacy isn't about who can put pills in a bottle the most efficiently or the most cheaply. The profession of pharmacy is about a relationship between a pharmacist, who is a healthcare provider, and the patient. A pharmacist, especially an independent pharmacist, would have discovered this problem, recognized it, and put a stop to it. That is something that an automated machine in a faraway state could never do. So if you're an employee who is receiving your prescriptions through a mail order benefit and you receive oversupplies of medications, the solution is to ask to be removed from the requirement of using mail order. Call your insurer. Call your human resources department at your employer. Tell them that you want to use a locally owned pharmacy. Some pharmacy insurers have an opt-out phone number that you can call and ask to be removed from that mail order list. I'm posting the numbers for the companies that I know. If you're an employer who provides a pharmacy benefit to your employees, whenever the pharmacy benefit manager asks that you require your employees use their mail order pharmacy, I want you to think of these pictures. While they're telling you that your business could save pennies by moving the business away from a locally owned pharmacy, they are costing you thousands of dollars in unused medications and you don't even know it. If the things that you saw in this video upset you, I'm asking that you not just click like on my Facebook page. I'm asking that you share this video. Until people realize the amount of waste that is inherent in the mail order pharmacy benefit, regardless of whether it's administered by a government entity or by a private insurer, until folks understand that waste that's out there, nothing will change. If you have any comments, feel free to call us here at the store or respond in the comments and I'll be glad to get back with you. Thanks for watching.